Okay, Dr. Morey, Uncivilized Vitality, the Anatomy playlist. We're going to do the Brachium today, which is basically your arm from your shoulder down to your elbow. We'll throw cubital fossa in here at the end, so we'll see, because I think those go together in the reference book that I'm kind of using to kind of stack all these videos together. So humerus is the bone that is in the brachium. Brachium is the arm region, and let's say it looks like this. So anatomic position, I'll draw a right humerus. So the head of the humerus is kind of tipped over like this a little bit, and then heads down, right? And as we head down, I'm drawing a short humerus so it fits on here. We get down here, we have the large medial epicondyle, the trochlea, and the capitulum, and then a smaller lateral epicondyle. So the diaphysis I drew kind of short because it's on the board, and you'll find a big bump up here called the greater tubercle, and then there's a little lesser tubercle, and these are going to give you kind of a groove down the front of the anterior surface of your humerus, and this is called the greater tubercle, more lateral, and the lesser tubercle, and then you have an intertubercular groove which goes between them. You get the surgical neck of the humerus because the head of the humerus tips over, articulates with the glenoid fossa of the scapula, making part of the shoulder joint. The rest of the shoulder joint will be the AC joint, sternoclavicular joint, scapulothoracic joints make the shoulder. So you've got a humerus, this is the long bone. Then you have the shaft, and you get down here, you got a conoid fossa. On the back, you've got on the posterior surface, you have the olecranon fossa. As the ulna folds up, and we'll get to forearm bones later, you'll go right there in the little fossa. There's a rounded little part that looks like a spool of thread on its side. That's called the trochlea. That is the articulation point of the distal humerus for the ulna. And then you have this little capitulum, this little bulged out part here that will be the articulation point for the radius. Remember, this is the right humerus, the bone of the brachium. The lateral aspect of the humerus, about a third of the way down, is going to be a deltoid tuberosity, a little bump, whereupon your deltoid muscle will insert in that lateral part of the humerus. Posterior aspect of this, you'll find a radial groove. It's kind of a groove that looks like kind of that on an angle, oblique angle from medial to lateral. We'll look at that on a posterior humerus, maybe in another video. So you have this bone. I shortened it. I drew it a little big so I can draw some muscles in there. The two tubercles, the greater and lesser tubercle, those are going to be the insertion points for the so-called rotator cuff set of muscles. So as the head of the humerus articulates with the glenoid fossa of my scapula, I'm going to have some muscles coming off my scapula, and they're going to sort of sit on top of the humerus. On the lesser tubercle, you're going to have a muscle that inserts from the subscapularis, that arises from the deep surface of the scapula and is going to come across and attach to the lesser tubercle. On the greater tubercle, if you look close, if you ever have the opportunity to look at a humerus, you're going to find three little facets, or little kind of shallow depressions in the bone, bony landmarks. And you're going to have a superior facet, a middle facet, and an inferior facet, and they're going to kind of roll down the sort of the posterior lateral aspect of the greater tubercle of the humerus. Superior facet would be your supraspinatus. The middle facet will be that infraspinatus coming around behind the head of the humerus and inserting there, the infraspinatus. And then the inferior facet, the greater tubercle, would be another muscle coming off your scapula, and that's going to be your teres minor, okay? Teres minor muscle. So those are going to form your rotator cuff, kind of cap on top of the humerus and hold that in place. You're going to have some other deep muscles that are going to insert along the groove, this intertubercular groove. So if you see this groove, you can consider this from the anterior surface the lateral lip of the groove, the floor of the groove, and the medial lip of that intertubercular groove, meaning between the two tubercles, greater and lesser tubercle of the humerus. Lying superficial from this anterior anatomic position, inserting along the lateral lip of that intertubercular groove is the pec major. Okay? Pec major is going to come across and insert there. On the medial lip of the intertubercular groove, you will have the teres major. Right? Teres major. Remember, teres minor is part of the rotator cuff muscles inserts on the inferior facet of the greater tubercle, mostly the posterior aspect of that, because then it will externally rotate. Teres major will come from the lateral border of the scapula and insert along that groove, the lip of that groove. And then, let's see, red, inserted along the floor of the groove and coming from the back would be the latissimus, right? That's your lats insert. Learned a neat little mnemonic about that one time. It's you picture a park bench with what the hell's her name? I always forget. Not Cindy Lou Who. Shirley Temple. That's the girl. So you picture Shirley Temple sitting on a park bench with two men sitting either side in army or military uniforms. And you picture a miss between two majors. So pec major, latissimus dorsi, and then teres major. So Shirley Temple, a little miss sitting between two majors. I know that's silly, but when I heard that, it just kind of stuck in my head to help me remember the order on that groove. So there we got 1, 2, 3, 4, 5, 6, 7 muscles attached to the humerus, none of which technically are intrinsic brachial muscles. So think about those as working the shoulder muscles coming from your torso, anterior, posterior aspects of your torso, internal and abductors, flexors, and extensors, so the big muscle movers. And then your rotator cuff that gives you some stability in that joint, part of the shoulder joint, so you can move this humerus around. Now on top of that, you have 4 other muscles of the brachium. So let's do a little cross section here. If we were to do a cross section about this level, we would have the humerus there in the middle. That's your humerus. And you would have a lateral intermuscular septae, which divides the arm into an anterior and posterior compartment. But then the medial intermuscular septae would delaminate a little bit, and it would have a posterior wall or element of the medial intermuscular septae and an anterior laminae or wall of the intermuscular septae. This little division in the intermuscular septae, this would be where you would find your neurovascular bundle, your brachial artery and your the nerves of your brachial plexus that run right down the inside of your arm. This is where you can find the pulse on a ped or a baby. That's where you take their pulse. I'm always saying that. This is also where if you were damage or murder minded, this is where you'd make a nice cut with something sharp to debilitate an upper limb. All right, let's steer away from that. So posterior compartment is one large muscle in there, and it's called the triceps brachii. Triceps brachii muscle. The triceps has a long head, which is going to arise from the infraglenoid tubercle of the scapula. And it's going to go down, join the bulk of the triceps, and insert on the olecranon process of the ulna. And then it has a lateral head that's going to rise from the posterolateral aspect of the humerus and insert on that olecranon fossa. And then it's got a medial head, which is going to be the posterior shaft of the humerus, about a third of the way down, 2/3, and then insert in that triceps bundle, triceps tendon to the olecranon process of the forearm. And the triceps brachii's job is to extend the forearm at the elbow or to extend the humerus at the shoulder joint to assist in those movements, innervated by radial nerve. Matter of fact, the radial nerve and the deep brachial artery are going to pass between the medially located long head and the actual medial head of the triceps brachii in the posterior compartment. Anterior compartment, deep muscles. You're going to have a muscle running from the coracoid process of the scapula down onto the proximal third of the shaft of the humerus. This is called the coracobrachialis. Right? Triceps brachii is the posterior compartment. Coracobrachialis would be located right there in this cross section, because you can imagine it running up to the coracoid process. It's going to run deep to the short head of the biceps brachii, which is going to come down and overlie this area. Right? Short head of the biceps brachii, short, long head. Biceps brachii, or brachii is how you should say it, but brachii. Brachii. Biceps muscle overlies kind of superficial to the coracobrachialis and fills up the bulk of the anterior compartment of the brachium. Has a short head and a long head. And as I've said before, in anatomy, typically, without exception that I can think of right now, long and short heads refer, and longus and brevis, when you have those pairs of muscles, it refers to the musculotendinous portion of the muscle body. So the long head of the biceps brachii is actually shorter than the short head of the biceps brachii as far as the muscle part goes. But the tendinous portion of the muscle is longer. And so when you're looking at it maybe in a cadaver course, the biceps brachii, the lateral most aspect of that would be the long head. The long head is going to insert or rise from, or attached to, the supraglenoid tubercle of the scapula. So long head of the biceps brachii, the flexor compartment anterior is going to come from the supraglenoid tubercle, and the long head of the triceps brachii and the extensor posterior compartment will arise from the infraglenoid tubercle on the scapula. The short head of the biceps brachii will lie superficial to the coracobrachialis and insert on that coracoid process. I'll do another video on the scapular bony landmarks, because that's a super help. And then that's going to come down and lay here. The biceps brachii is going to insert on the radial tuberosity in your forearm, radius being the thumb side. It's going to insert there, and its main action is going to be, you would think, to flex the forearm at the elbow. That is one of the synergistic actions of the biceps brachii, but its main action is to, I don't know if you can see this on video, is to supinate my forearm. You can check that at home by supinating forearm. That's its main job. Its synergistic job is to flex the forearm at the elbow and to flex the humerus at the shoulder. Right? And with the short head, you could even make an argument that it brings it in a little bit, maybe a little rotation. So if I bring all the biceps actions in, it really brings my palm close to my mouth. So I like to think of the biceps brachii as grab it and cram it in your cram hole. That's your eating muscle, not your beach muscle. The real powerhouse that flexes the forearm at the elbow with more power than the biceps brachii would be in cross section. If we got down here to the distal third, where you wouldn't see the coracobrachialis anymore, would be this thicker muscle that lies along the shaft, anterior shaft of the humerus, and inserts on the ulnar tuberosity of the forearm to work in pairs. In a pair, so you get a nice even flex of your forearm with the biceps brachii, and that one is called the brachialis. Not to be confused with the brachioradialis, which we'll get to in the forearm muscles. So mainly the four muscles you have of the brachium be the triceps for flexing the forearm, or extending the forearm at the elbow. That's going to be radial nerve. Talked about the attachment points. And then on the deep surface, the anterior flexion compartment, coracobrachialis, which is going to flex the shoulder, humerus at the shoulder. The brachialis, which is lying along the shaft of the humerus distal and will help, inserts on the ulna and will help flex the forearm at the elbow. And the overlying those two muscles superficially, running from the two places on the scapula, ironically it doesn't even insert on the humerus, the coracoid process for the short head of the biceps and the supraglenoid tubercle for the long head of the biceps, and then they run down and insert on the radial tuberosity. There's a bit of a bicipital aponeurosis over the ulna as well, which we'll come back to in a hot second, and that's going to help flex the elbow and the shoulder. Brachioradialis is going to be the workhorse of the elbow. So people do a lot of elbow flexion exercise in the gym, thinking they're really hitting their biceps. Mainly they're working the brachialis, and they're getting some synergistic flexion from the biceps. If you really were working or isolating the biceps, you would pronate and flex the elbow as you flex the shoulder. This would really work the biceps brachii more. But this is not some kind of bodybuilding goofiness. Musculocutaneous nerve will innervate the rest of the flexors of the arm. And what else? We'll go back to neurovascular bundle in another video. That's probably it. Let's just call that brachial arteries, or brachium. So if you're interested in the forearm, if you like that kind of quick anatomy, just kind of the highlight stuff, leave a comment, thumbs up. Use this if you're in school and you're studying for a test or something. And subscribe to the channel and share that, and check out some of our other videos.